important new legislation that will make it easier for our city's veterans to access mental health services. I'm New York City Council Speaker Adrienne Adams, and as I always say, I do have the honor of leading our historic women majority council and the men who get it. I'm here today with Councilmember Linda Lee, Chair of the Council's Committee on Mental Health, Disabilities, and Addiction, Councilmember Robert Holden, Chair of the Council's Committee on Veterans, Council members Mercedes Narcisse and Eric Dinowitz. Public advocate will be here soon. And our incredible advocates from Community Health Network, the Institute for Community Living, Project Renewal, Black Vets for Social Justice, New York Legal Assistance Group, SAGE, and Legal Services NYC. In April, we released the Council's Mental Health Roadmap, a holistic, community-oriented plan to improve mental health outcomes for New Yorkers, made possible by the leadership of our dedicated and insightful chair, Councilmember Linda Lee. We envisioned it as an ongoing roadmap, one we can continue to add on to as we work with stakeholders across the city to better support New Yorkers in their recovery, healing, and treatment. The first stop of our mental health roadmap focused on increasing access to community-based preventative services, investing in the mental health workforce, confronting the harmful intersections between mental health and the criminal justice system, and bolstering public awareness of care resources. Several months later, the Council passed critical legislation that was part of the first segment of the roadmap. These solutions will have tangible impacts on our communities, expanding clubhouse-style community centers for individuals with serious mental illness to access peer support, services, and employment and educational opportunities in a safe and structured setting. Crisis respite centers to provide community-based alternatives to hospitalization for people experiencing an emotional crisis will now also be more available to New Yorkers. These represent important advancements for mental health care, and yet we know there is further work needed. Today, we are announcing Part 2 of the Council's Mental Health Roadmap in support of our city's veterans. My father-in-law, my father, and husband all served in the United States Air Force, so I truly understand the importance of supporting those who have sacrificed for all of us. The Council's legislation is intended to contribute positively towards ensuring our beloved veterans have access to mental health services. As a government, we must do right by our veterans and offer tangible support. While there are mental health resources and other services available for veterans, navigating these resources can be challenging to the point that it inhibits them from accessing what they need to be safe and healthy. The bills we're unveiling today are aimed at resolving some of these longstanding issues we've heard about from the advocacy community in order to help veterans fully utilize the services that are needed and should be available to them. Councilmember Linda Lee and Public Advocate Williams have bills that would require the city's Department of Veterans Services to develop and distribute informational pamphlets on services available to veterans and conduct community outreach, empowering veterans with this information. These public education efforts would help alleviate the barriers that veterans face when seeking help. Other legislation by Council members Dinowitz, Narcisse, and Lee would seek to ensure that our data on the provision of mental health services by city agencies are up to date and accurate. Together, these bills, along with others, will help to ensure that our veterans are supported in their recovery and that no one is left behind. We know that there will be ongoing work needed to advance this goal, and we are committed to providing continued leadership and support. I thank our fierce advocates for the work you're doing in our communities and to support our veterans. And of course, our wonderful Mental Health Committee Chair Linda Lee, Veterans Committee Chair Robert Holden, Council members Mercedes Narcisse, Eric Dinowitz, and Public Advocate Jamani Williams for your work in uplifting our city's veterans who deserve our full support. Now, I will pass it along to Council member Linda Lee.
Thank you, Speaker. Thank you so much, Madam Speaker, and good morning, everyone. I tried to do my part today by wearing white, blue dress with the red stars on here, so I'm trying to, embrace the colors of the American flag. But as you all know, months ago, as the speaker just mentioned, we went and embarked on an ambitious goal, creating a mental health policy platform that would chart a way out of our city's current mental health crisis. And I have to admit, a lot of my personal frustrations and experiences of working in the nonprofit sector and in mental health went into this as well, because as we know, we have a very broken healthcare system and mental health care system that's been divested for many, many years. And so right now we're just trying to meet the needs of where the community's needs are right now. And we wanted to outline a plan spanning multiple levels of government that could address decades of government neglect and the revolving door of hospitalizations, discharges, and arrests that has trapped some of our most vulnerable New Yorkers. And I won't go over the recap that the speaker so lovely gave of what we've done so far up to date. And we knew from the beginning that mental health is a pervasive issue too large for a one-off policy platform. This roadmap was intended to be a living, breathing document, a continuous process with multiple quote-unquote stops, driven by legal research and input from stakeholders and advocates out in the field. And that is one thing that we wanted to ensure, is that the community voices are at the table in guiding us with the legislation around this roadmap. So thank you all for being here. And just look at the breadth of experience among my colleagues from the council here. Councilmember Dinowitz, chair of the Committee on Higher Education and former public school teacher. Councilmember Narcisse, chair of the Committee on Hospitals and a former nurse, of course, who has a ton of experience working in the healthcare field. And Councilmember Holden, chair of the Veterans Committee, former graphic designer, in case you guys didn't know, and professor. And I have to say, at our last joint hearing that we had, just your personal experience in being, a family member of a veteran who suffered from PTSD, I have to say is very incredibly important for more of us to hear about. So I just want to thank you for sharing that story. And as a social worker, I've tried to ingrain in this roadmap the mantras of meeting the people where they are and breaking down silos, cutting red tape, and streamlining services. None of this could have been possible without Speaker Adams' leadership and investment. And today we are here to announce the next step of the mental health roadmap, which will prioritize our veterans and their unique needs following their separation from military service and their reintegration into civilian life. And just on a personal note, I would not be here if it wasn't for my great uncle, Joe DiNardo, who is also a veteran, and he actually sponsored my entire family to come here to the US. And so if it wasn't for him and all of his contributions, we would not be here today. I'm going to let my colleagues talk about the specifics of their legislation, but there's a lot of common sense bills and resolutions here, such as mandating public outreach for mental health resources, specifically for veterans, which we heard over and over again in the hearings. This is probably the #1 issue, is the outreach and getting folks plugged into services. Collecting demographic data on our veterans population and calling on our partners at the state level to provide the financial assistance necessary for service and emotional support dogs. The work is far from over. And I want to thank some of the advocates that are present here, which I know the speaker mentioned, but I think it bears mentioning again. Project Renewal, Black Vets for Social Justice, Institute for Community Living, SAGE, Legal Services NYC, Community Health New York. And if I'm forgetting anyone, please let me know. And lastly, I want to thank our hardworking staff who continue to inch us closer to that finish line. And I'm sorry if I forget anyone. But Megan Lynch, of course, who's back here, Smita Deshmukh, Christy Dwyer, Sarah Sucher, Nick Connell, Julia Agos, Rendy Desamores, Mandela Jones, Shirley Lamangi, Sarah Liss, and Lorian Valentin. So thank you all for your hard work in making this happen. And without further ado, I will bring up our chair of the Committee on Veterans, Councilmember Bob Holden.
Thank you, Linda. And I just wanted, since you opened the door on my personal story, I'm going to repeat it because I think it resonates today. But I just wanted to do it in front of the speaker also. So I'm going to just give you some of the highlights of the Senate Bill 4717 and the Assembly Bill 3149 with my reso. I'll be introducing a reso in support of two bills. by State Senator James Sanders and Assembly Member Pamela Hunter. That was S4717 and A3149. These bills aim to provide financial assistance to veterans for the purchase, training, and upkeep of service and emotional support dogs. So that's an important step. Emotional and service dogs are more than just pets, okay? They are lifelines for many of our veterans grappling with post-traumatic stress disorder and other mental health challenges. A timely passage of these bills will be a giant step in addressing the mental health and emotional challenges faced by our state's veterans. But I'm going to flip the script a bit and talk about being the chair of veterans, how important it is to me, and growing up, and how it all kind of falls into line as kind of the final chapter in my existence, because I'll give you a quick, and I hope I don't go on too long, Speaker. Just pull my coat if I go on too long, but because it is a long, but I'll shorten it. My dad had post-traumatic stress disorder. It wasn't diagnosed, but he served in World War II in the Philippines. Horrible hand-to-hand combat. He served in the medical unit. Now, the medical unit they would say medic, and they would call, when somebody was hit, they would call them over, and he had so many men die in his arms, and it affected him. My uncle served with him, and it didn't affect him, he said, but being in the medical unit is probably one of the worst jobs. You have to be out in combat, and they were trapped in the Philippines, but they never told me the story. So I disliked my dad. I didn't like him. He couldn't function. He got fired. He was an alcoholic, but we didn't know why. We just thought that's the way it was. And in 1995, when he passed away, my uncle called me over and he said, Robert, you were very hard on your dad. He goes, I know he couldn't function, but you never met your real dad. You never met him, because the war changed him. He was the greatest guy I knew in the world, but the war changed him. So that resonated with me. I was just like, oh my God, geez. I hated my dad. I could say that. I never had a conversation with him. I didn't want him around. And now that kind of like, I felt this big. And I said, what can I do? What can I do? So I took care of my mom. My mom would actually go and serve the veterans. Every weekend she'd go down to the VA hospital in Manhattan. And until she was about 88, when she got dementia, she got lost coming back. But she, every weekend, religiously, sat with the veterans, and then joined service groups in the neighborhood, veterans, American Legion and so forth, and became in the Ladies Auxiliary, helping some of the veterans who were struggling with a number of things. So when you made me the Veterans Chair, and it was not that I asked for it, it was I remember sitting with you and I said, this is what I would like to do, this, and you were just nodding your head. But somehow, and there's a God above, because when my mom passed last year in February, and then you made me chair of veterans. Now, I got chills when that happened, and I never told you this, but it really kind of solidified my existence on this planet to say, this is what I have to do. I have to carry on my mom's work. I have to make amends to my dad, because now I could do that. And with the mental health initiative, this is where it all kicks in. So that's why I'm so committed to the veterans, because I owe it not only to my mom, who took care of 4 kids, by the way, who had to be our father and mother. She had to have 2 jobs because my dad couldn't hold one. And I went down multiple times to the Veterans Administration with my mom to try to plead our case. We never got any disability until 2 years before my dad died. We got 100% finally, because they recognized his illness. But by then it was too late. He never got help. As a family, we didn't get help, but it kind of falls in line. And with my dad coming from the Philippines, and he hated the Japanese because he had to suffer there. And I didn't understand that because he never said anything. So when I married a Japanese American, of course, he cut me right off. He wouldn't even come to my wedding. But I didn't understand it, and I carried that grudge until my uncle finally said, what he said, how the horrific fighting was there and how we had to endure the most horrific, disgusting situations that you can imagine, and it affected your dad. So that's why this is a very important committee to me. This kind of completes the chapter. It's eerie that I got veterans. I think you planned that, but but you didn't know the history. And then when you get older, by the way, when you get to be my age, you start to look back and say, how things kind of fall in line, don't they? Things kind of even out. And now I have my chapter, my final 2 years in the council, to really make a big difference in the lives of veterans. So again, I want to thank you, Speaker. You have no idea what you've done for me. Thank you so much.
Thank you, Councilmember Holden. And I think you and I share similar stories in the sense that I was not planning on being the mental health chair either. So you must have something, foresight that we don't know about. And next, I have the pleasure of introducing Eric Rosenbaum from Project Renewal, who has and is doing this incredible work. And so I just wanted to invite you to come up and speak about the work you're doing.
Thank you so much. Good morning. It's a privilege to be here today with the City Council and among colleagues and leaders who are so deeply committed to supporting New York City's veterans. I'm Eric Rosenbaum. I'm the president and CEO of Project Renewal. For more than 55 years, we've empowered individuals and families who are experiencing homelessness to renew their lives. We serve New Yorkers, including hundreds of veterans, through our wraparound services that are focused on integrating health, housing, and jobs. Project Renewal is grateful for the Council's commitment to creating a comprehensive, responsive mental health system through its mental health roadmap, and for its particular focus on the needs of veterans. As one of the largest providers of specialized healthcare services to New York City's citizens experiencing homelessness, we know that mental health challenges create profound barriers to well-being. By assisting our clients to attain stability and prepare for their future, we're proud to be doing our part to help New York City attain the roadmap's goals. Project Renewal directly supports the mental health needs of veterans through our mental health shelters and other health programs. Our culinary arts training program also provides crucial workforce support for veterans. Our veteran participants often express how meaningful it is to apply the skills that they hone during their service, like discipline, teamwork, and leadership, to embark on a new career path. Finding that renewed purpose is a boon to mental health. It's vital that New York City address its diverse mental health needs of veterans. Thank you again to the City Council for advancing this mental health roadmap with special attention to the needs of those who have so bravely served our country. Thank you. Thank you.
Okay, and next it's my honor to bring up our amazing Councilmember Mercedes Narcisse, who also chairs the Hospitals Committees, and to talk about her bill. So, Councilmember.
Good morning, everyone.
Good morning.
When we talk about our veteran, this is very special because for many, many years we talk about how the importance of the veteran in our community. But for me, like I always said, I have skin in the game, and I have skin in so many things being a nurse, and I have a big family members. Today's focus is on the veteran mental health and specifically helping connect veterans to services in New York City. My close family, like cousins that I live with and grew up with, is a vet, and I can see about mental health because when he called me, he cannot function with his job. And I have two active cousins right now. So it's real. Mental health is real. And to follow up with Council Member Holden, the speaker actually, everyone that is position of leadership right now, that chair of every committee, if you follow, are those folks that function in their areas. Yeah, and thank you for your leadership. Thank you for listening to us when you're making the tour, and understand the importance of the experience that you have in life to bring in the forefront, to help those in need and make New York City, and address the inequities and make New York City a better place where we all can live. I wish to express my deep appreciation to you again, Speaker Adams, my council colleagues, of course, Linda Lee, that we talk so much because she's a social worker and I'm a nurse. You know, we have a lot in common. Advocates, thank you, and all the championing of the mental health roadmap. That roadmap mean a lot to me, because mental health is real, and I always say that. And especially in my community, I'm from a community where mental health is taboo, and my love and passion to serve the veteran, because I always said the freedom that we're all taking for granted are given to us by veterans, and they deserve our full attention. As a nurse, the importance of mental health support, particularly for our veterans, has always been evident to me. During my first term, I underlined the significance of mental well-being of all New Yorkers. Beyond addressing a medical condition, it's about our commitment to the overall well-being of everyone, our veterans. After enduring intense challenges, they warrant our complete respect, attention, and support. I'm honored to co-sponsor my council member Dinowitz's bill, which aims to gather vital information on our veterans and optimize the resources available to them. Additionally, tomorrow, I will be introducing a bill that mandates the Commissioner of Veteran Service annually submit to the Speaker and post on the department's website to report summarizing the mental health services offered and provided by the city agencies to veterans. This bill not only reaffirms our dedication, but strengthens transparency and accountability. As we progress on our mental health roadmap, my dedication remains unwavering. Every New Yorker, especially our veterans, must have unobstructed access to mental health resources they need and they deserve and they work for. So I have to shout out to one of my friends that always push and took me around to assess veterans and having a deeper dive at the importance of serving the veterans is Marie DeLuce. She's always a great advocate, and I'm sure one of you probably knows Marie DeLuce, that goes around and carrying the flags and take me to every corner that veterans live for me to be committed. And we affirm that they need their help, and I have to fight every single day. And thank you for the opportunity, and all my colleagues that have been working on this. This is great, and it's a great day for New York City when we admit that the freedom that we're enjoying so much, that we can give support for those that really actually helping us to be here. Thank you so much.
Thank you so much, Councilmember Narcisse. And as I've said before during these press conferences, I love data because it really tells a story and helps inform us of what we're missing, what we can do better. And so I just want to thank you for your bill and legislation. And next, I'd like to invite up Wendy McClinton, who is from Black Vets for Social Justice and is also doing an amazing, important work on the ground. So Wendy, if you could join us up here. Thank you. Thank you.
Thank you to Madam Speaker, to each and every council member in your respective places, to everyone that has joined here. Thank you so much for these initiatives. Thank you so much for the work that you're doing to forward the services for veterans. I am not only the president and CEO of Black Veterans for Social Justice, I am a 10-year United States Army Honorable Discharge Desert Storm Persian Gulf female veteran. And thank you. And working on the ground with Black Veterans for Social Justice, we do have various programs that deal with employment and housing, but there's one program that I do want to share about, and that's the Staff Sergeant Fox. And it's the suicide prevention program, but it also has a major component that deals with mental health. It is imperative that these initiatives continue. Because if we can now identify those soldiers, those service members with have issues before they come out of the military, we're able to better address them at that time when they reach our city. And so these initiatives through the City Council, they must also continue with the state and also with the Department of Defense, because that's where the collaboration comes in. And we're able to better service them, not only them, but their family members as well, because they need those services too. So again, I just want to say thank you so much. If there's anything that Black Veterans for Social Justice can do to assist, we're more than welcome. Forward ever, backwards never.
Thank you.
Thank you so much. And next up, we'll have, I wanted to invite up my colleague, Councilmember Eric Dinowitz, to come and speak about his pieces of legislation as well.
Thank you. I'm Eric Dinowitz, council member in District 11 in the Bronx, or as the speaker refers to me, Eric Dinowitz, a man who gets it. Did I get that right? Okay. I'm in the Men Who Get It caucus. What can I say? So first off, let me say happy Veteran Appreciation Month. This is a resolution we just passed in the council. November is now in New York City Veteran Appreciation Month. It's really an honor to be doing what I can for our veterans. I actually had the honor of chairing the Veterans Committee in the previous council for a few months before this council. And I think the work I did, let me just say, pales in comparison to the work Chair Holden is doing. But it's in that work that I really got my first, I think, real exposure to the incredible work our roughly 200,000 veterans and their families have done and do in our city. I don't think it's an exaggeration to say that a number of us and our friends and our family would not be here, but for the work and the sacrifices our veterans and their families have made. My own grandfather served in the Army Air Force during World War II, back when they were one unit. But you hear all these stories you hear, about people being saved during the different battles in all of our wars. Those are New Yorkers who are being saved, who will never meet the people who allowed them to be here. So I am forever grateful for our veterans. There are a number of incredible bills being proposed today about making sure our veterans have the mental health supports that they deserve and they have earned. And before I get to my bill, I do just want to say, Bob, your story was the first time I heard that story. It was incredibly moving. And I'm almost up here at a loss for words, because I think it does speak to the need for mental health support for our veterans and for their families. I will share, there was one piece of legislation we got to pass when I was chair of veterans, and that was a change to the city charter, which said that the Veterans Advisory Board will additionally, per this legislation, include 2 family members of veterans, in addition to the 11 veterans who are on the committee. I think, hopefully, to speak to the experiences that you had and have now, I imagine, as you look back on your life and your experience with your father. The bill that I'm proposing with council members Narcisse and Lee asks what I think is a fundamental question that we need the answer to in order to best serve our veterans. And the question is, who are our veterans? And this bill would require the city agencies to simply ask that on their intake forms. And you imagine a SCREE application or a veteran going to the senior center and filling out the paperwork. And the questions there are, have you served in the armed forces? Not, regardless of your discharge status, have you served in the armed forces? And with that information, all of the outreach that we want to do to our veterans, all of the support we want to give them, we are better able to do. We are better able to serve the neighborhoods with the most veterans. We are able to target them with all the distributions of the pamphlets and the information about mental health supports because we know who they are. So I am incredibly grateful for the Speaker for making sure this legislation goes forward and for being a Speaker who cares about our veterans, who cares about the members of the armed services, who allowed me to exist here, allowed my family to exist here in the United States in freedom and security. And I also want to, of course, thank Chair Holden, Chair Lee, and Chair Narcisse, and of course our public advocate, Jamani Williams.
That is the perfect segue to introduce our amazing public advocate, Jamani Williams, who I know cares deeply about this issue. So thank you so much for joining us.
Thank you so much. Thank you for calling me amazing. I appreciate it. Thank you, Councilmember Lee, and our Speaker for bringing us all together, and all the council members who are here and chairs who are here. And thank you for bringing a cross-section of folks. That just shows you how important this is to everybody, the cross-section of thought that's up here, to talk about the role that mental health plays in supporting our veterans. Mental health has always been very personal to me. I've been as open as possible about my search for the best healthy mental space that I can find. And I think that the stigma associated with seeking support has done incredible damage that we're trying to undo. The stigma also exists within the military community, and I hope this package of bills helps to address both the system and the stigma. Too many veterans, including my family, have given so much, are disrespected or abandoned by our government when they return home, even after they've completed their part of the contract. They're met by government failing or to fulfill their end of the contract. It's been clear to me for too long and too often, we thank veterans sometimes with words, but not as much as actions. I had the honor and privilege of working alongside veterans in my time as a city council member, passing a law to prohibit housing discrimination on the basis of veteran status and military history. During that process, I heard the stories and felt the pain of veterans who lacked services and felt there was nowhere they could go, no one they could turn to. The bill that I have as a part of the package will aim to help veterans be aware of and get access to the services and resources available through the Department of Veterans and throughout city agencies. It's critical to let people know their rights and let them know what resources are available to them so they don't feel alone, they don't feel abandoned. That is true for all of us. It goes doubly for veterans who really did a lot and served their country in ways that many of us may not and have not. By offering both online and physical resources to get this information in the hands of people who need it, we can help connect people to care that they so desperately deserve. And I just want to, again, thank everyone in my family who have served in the military this month, and I want to thank all who stepped up in service. I hope that the bills being discussed today, the council can serve people who have helped serve us all. Thank you so much.
And of course, to close us out, last but not least, we have President CEO Jody Ruden, who is running an amazing organization, Institute for Community Living, that is doing tremendous work, not just with veterans, but with people with mental illness across the board. So I just want to thank you so much for being here and invite you to speak.
Good morning or good afternoon. I don't have a watch on. Thank you, Speaker Adams, and thank you, Councilmember Lee, for your leadership on mental health, both in the form of the comprehensive roadmap that we've heard about and also with respect to the package of legislation that's being put forth today, which will undoubtedly help veterans across New York City connect to much needed, critical, and often life-saving care. Thank you. My name is Jody Ruden, and the organization that I lead, the Institute for Community Living, helps over 12,000 people a year get better through comprehensive housing, healthcare, and recovery services. And one of the programs that we're privileged to run is the Borden Avenue Veterans Shelter, which serves over 250 homeless veterans on any given night, people who are facing the trauma of having served in active duty, the trauma of homelessness, struggling with serious mental health challenges and addiction. Councilmember Holden, I want to thank you and recognize your efforts in helping to make the Borden Avenue Men's Shelter a more equitable environment. You have worked with us in an incredibly hands-on way to ensure that everyone living at Borden has privacy in their living spaces at night, and that has done more than you will ever know to help restore dignity to their lives, and I wanted to acknowledge that and to thank you. Of course, there are structural problems and funding problems with emergency shelter that will prevent it from ever being great. So my colleagues and I at ICL are passionate about healthcare, housing as healthcare. And I'm proud that in our last supportive housing development, we set aside 20 units of permanent supportive housing for people exiting Borden Avenue as a pathway to stability while they work on their broader recovery. We want to do a whole lot more of that, and we want to partner with all of you on hopefully mitigating the impact or avoiding any adverse impact on both veterans and people struggling with serious mental health challenges throughout the city on this 15% budget cut that's been announced. So thank you for your leadership and your work, and looking forward to continuing to partner together.
Thank you.
Thank you so much for joining us today. And I think the beauty with this roadmap, again, is the fact that it is a living, breathing document. And what we introduced earlier this year, just as an example, which was the preventative services, the peer-to-peer support, these are all things that would be incredibly helpful for the veterans community as well. And one of the hearings that I talk to with Chair Holden all the time is one we did last year, where they talked about the lack of peer support amongst veterans themselves, and it's something that they could get training for. I think at the one that we were talking about, there was one person who was there, and that makes such a difference, but it's not enough. And so how do we bolster a lot of the programs that we know are working in the community? How do we give access to folks that are already providing the work, like the great organizations that are here and help support? And so hopefully these are the things that we're trying to push forward and address with this roadmap. And again, advocacy input, community input is extremely, extremely important as we move forward. And so I just wanted to thank especially all the community groups and advocates that are here today doing the amazing work on the ground. And please continue to be partners with us in this roadmap, because it is, again, something that we would like to adjust and, you know, make better as we go along. So thank you so much to everyone.
Well, this concludes our segment here. I just wanted to throw in, you know, when we speak about veterans and we speak about the work of our veterans, before I say that, Councilmember Holden, just amazing, and so compelling. Your story, so compelling, and I hadn't heard it. Wow. But I did, as I do with the committees, I have a feeling about our leadership on committees, and it's been working out really well, actually. So I also wanted to acknowledge, we speak about, you know, the Army, the Navy, the Air Force, the Marines. My daughter and my son-in-law are members of the Army National Guard as well. So, you know, people consider them as weekend warriors, but I can personally attest to the toll that it takes on families, you know, when we do have disasters here. Stateside, we have floods, we have hurricanes, we have all kinds of, you know, issues that affect that segment also of the military. So I just wanted to acknowledge them as well. Rather selfish of me, I know, selfish plug. So they're hard workers. So I don't know if we have any questions, but this does conclude our press conference. Okay, thank you all so much.